Good morning, everybody. Welcome to the start of the Isles of Scilly Health and Wellbeing Board meeting on Wednesday, 4th of February 2026. We're running a little bit late. For reasons I explained outside the start of the meeting, we're going to move into the presentation first, and then we'll come back to other formal agenda items in due course. So I'm not entirely sure who's kicking off with the presentation.
Good morning. I'm more than happy to start.
That would be fantastic. Please go ahead.
Thank you. First of all, can I just apologise for not being on the islands with you this morning? Unfortunately, something came up and I had fully intended to come across. And the only other thing I will say is I'm on call at the moment. And there's been a major incident that had been declared last night in Devon, which we'd been pulled into. I think that has been stepped down, but just in case I get a phone call, John Groom and Juliet Ferris, both from ICB and CFT respectively, are here and know the presentation should I have to take a call, so I do apologise. Thank you for inviting us. For those of you who don't know me, I'm Susan Bracefield. I'm currently the Acting Chief Executive for Cornwall and the Isles of Scilly Integrated Care Board. Previously, my substantive role is the Chief Operating Officer and the Chief Nursing Officer. And the interim at this point in time is as we move close to a cluster arrangement with Devon ICB, where there will be, I'm hoping, very soon, an interim cluster chief executive that will go across both Cornwall, Isles of Scilly and Devon. So at the moment, it's me until such time as we cluster, which will be at the end of March. So thank you for the opportunity. As I say, I've got two colleagues here today, and having Katie as well is really helpful because an awful lot of the work that we've done around our 5-year plan has been working really closely with all our partners, including local authority, and you will see that from the presentation. However, just to outline the purpose of bringing the presentation and the paper to you today is that it would be great for you to be able to review our 5-year plan, which is in draft format at the moment, to provide feedback, whether or not you feel that the plan takes proper account of the services required within the Isles of Scilly, so that we can then finally make a statement once we publish the plan. What I will say is the 5-year plan that we've produced takes account of many other pieces of work that are going on in Cornwall and the Isles of Scilly. So we have something called our commissioning intentions, which John will speak in more detail to, as well as the health and wellbeing strategy that we have for Cornwall as well. One of the things that we have been criticised in the past about is the amount of plans that we have in health. And what you don't often see is a golden thread that goes between them. The golden thread for this particular plan is first and foremost is the 10-year NHS plan, which we absolutely have to take account of. And the other golden thread is the work that we do in partnership with the local authority around the life courses. So that's the Start Well, Live Well and Age Well. And our commissioning intentions takes account of those life course groups and some of the priorities that come out of that. If you just indulge me for a moment, the 10-year plan is really important because it frames the work that we're doing, and it sets out 3 big shifts for the NHS and talks very much about how the NHS needs to move into a different way of operating, a new way of operating that takes account of our socioeconomic issues that we see across England, but also the demographic as well of ageing, the ageing profile. And we know that in Cornwall and the Isles of Scilly, the one thing that makes us unique is we are ageing faster than other parts of the country. And we see that in some of our frailty numbers, people that have had a diagnosis of frailty. And we know that frailty goes hand in hand with some of our long-term conditions and multiple morbidity. And what we're seeing as people living longer is they're living with more conditions, which makes some of that treatment much more complex, not necessarily acute, but certainly more complex. So the 10-year plan is also is looking to how we give a better experience to people who are aging, living longer, but not necessarily have lived well. And that's really important. What I am about to say, though, for our plan, it covers all ages, and that's really important. And if you're not spotting certain things, it doesn't mean that it's that we are not still working with all of the treatments and conditions like cancer, for example, some of those conditions that affect are very young people and people in middle age as well as older. Just because you don't see it in the plan doesn't mean that we're not addressing it. A lot of that is our business as usual. But what we've picked out in the plan are the things that we know are driving some inequalities for our population across Cornwall and the Isles of Scilly. So one of the first things that we've been asked to do is move from more from hospital to home, hospital to community. And when we talk about hospital, we're not just talking about acute trusts. We are talking about community hospitals. We're talking about mental health institutions. We know that when people are in institutional care for longer periods than needed, they don't fare well. And we see this in our elderly in particular. We know that if you're over the age of 65 with a frailty condition, for every 10 days you spend in hospital, you lose a considerable amount of your muscle mass. So in order to get people out of hospital, without doing any harm, we need to do that really quickly. So our commissioning intention speaks to that. And again, we can come on to that in a minute. We also want to offer more choice at home. We know that our acute trust, particularly in Cornwall, is the only acute trust that we've got. And an example I'd like to share with you is I was on call at the weekend. And one of the things that I was told was we didn't have any high care stroke beds and we didn't have any high care coronary beds. That's not acceptable. RCHT is our only acute trust, so we need to make sure the sickest people have access to the most acute services and specialised services. Our next hospital, of course, is Derriford across the border, and that serves 20% of our population that face into it, but it also serves 100% of the population for Cornwall and the Isles of Scilly for something we call tertiary services. So those are very, very specialist services. People, for example, that need very complex cardiac surgery, people that have complex neurology, brain tumours, those people will have to go to Plymouth. So in order to support Plymouth, we need to make sure that the services we have in Cornwall are used to the best efficiencies that we possibly can. So not all people who have gone to hospital in the past need to go to hospital. And what we're building is a cadre of services within Cornwall and the mainland and on the islands that keep people closer to home for as long as we possibly can, or at least return home as quickly as possible once their acute care has been completed. And again, I'll remind folks that this is as much for mental health conditions as it is for physical health conditions. Keeping people in mental health institutions is just as damaging potentially as it is for people who are in acute trusts. So when I'm talking about the three headings, there's a huge amount of work that sits behind them, but it's helpful just to take that helicopter view to let you know what we're doing. Analog to digital. This is a big, big piece of work that we need to land in Cornwall and the Isles of Scilly, particularly in the islands, because it's what keeps us in touch with the population on the islands, and how we get the most up-to-date digital services is incredibly important. And I think that the work that's been done in Cornwall and the Isles of Scilly today has been really good. It's been a real, when you compare us and benchmark us to other parts of the country, we've got some fantastic work that's happening. Some of it has been born out of COVID, never waste a crisis, as they say. So some of the work that we've done has really accelerated our ambitions because of COVID, and we'll continue to accelerate that when we go into the cluster as well. It's very much on the objectives and priorities for Devon as it is for Cornwall and the Isles of Scilly. We are not ignorant to the fact, though, that we have something called digital poverty. So we know that affects all ages as well. So the work that we do with our voluntary sector, with our local authority, all of those partners ensures that people have equal access to the digital technology. And it's a big part as well of keeping people at home. So we do something called hospital at home, virtual wards, I think was the old parlance that we used. So people that can be looked after in their own homes with digital assistance, really important. And we're seeing a proliferation in the services that are out there around digital that I think we need to harness, that is a different way of commissioning service in health to what we've done traditionally. And the other thing is allowing people to access their own care and have more say over their care is really important. But if you're on the, I don't know how many of you have got the NHS app, you get results through the NHS app. We're very aware that we need to provide support, because if you're on a Friday afternoon or even a Saturday, as I've had, and you get your results through and you're worried about it, where do you go? So we need to make sure the infrastructure around the ability for people to get access to their records are really important. So some of the work that we're doing around case management, case coordination is incredibly important to make people feel safe, but also to have confidence in the information that we're giving them. And sickness to prevention, huge piece of work. And this is where our public health colleagues are so incredibly important. And the work that we do with them and the lead that we take from public health is incredibly important. If we get further upstream in general health, physical health and mental health, the less people we'll see hit crisis, the less people we will see have multiple admissions into hospital. And you can apply that to so many different conditions. Three of the main conditions that we agreed in Cornwall and the Isles of Scilly that drives admissions into hospital and into services is around cardiovascular disease, respiratory disease, and frailty. Those really drive admissions, but they also drive a poorer quality of life. So a lot of the work that we've done in terms of our strategy, clinical or otherwise, has focused on those conditions. And when you start to look at some of the social determinants of health, you see much higher numbers of cardiovascular disease and some of the chronic respiratory diseases in those people that live in some of our poorer areas. So being able to tackle those and being very upfront about what we're doing is incredibly important. And all of that we're encapsulating in something that you probably have heard of is called neighbourhood care. So I think it's fair to say that Cornwall and the Isles of Scilly has been seen as a pioneer in this area, and we've been name checked in the 10-year plan. I've been fortunate enough to go to a few national meetings recently, and we often hear Cornwall and the Isles of Scilly being referred to in the work that we've done around neighbourhood. Juliet is your, for want of a better title, place director for the west of Cornwall and the Isles of Scilly, ensuring that we are meeting the needs, because across Cornwall and the Isles of Scilly on its own, we see a wide variety of needs in terms of health and social care. The other thing that I would like to talk about is estates. Because in doing neighbourhood care, good neighbourhood care, we have to make sure that the estates are in good nick, they're in good repair, but actually they serve the needs of our total population. And some of the mistakes that we've made, and I've been around in the NHS for 40 years, so I've seen some of those mistakes firsthand, is we work in silos. So our local authority will come up with some fantastic services. We come up with the same sort of ideas in health, and we never talk to each other. So neighbourhoods are bringing partners together to make sure that what we don't do is create, and I've heard this from people, from mums in particular with young children. There's a maternity hub in one part of a town, and then there's a health and wellbeing hub in another part of the town, neither of which are on a bus route. So if you don't drive, and in Cornwall, if you don't drive, that's a problem. Same with the islands, getting around is not easy. So making sure that infrastructure, both digitally, but also bricks and mortar, is fit for purpose. And I know that's an awful lot of the work. It's slow because the estates that we have within health services particularly are old. They've not had the proper investment. So we're doing quite a bit of work around our estates. One of the other things that we're really aware of is and the priorities that we've linked our commissioning intentions around are things like waiting lists. So we know that we've had a big waiting list issue in Cornwall and the Isles of Scilly. I am delighted to report that for our acute trust treatments, surgeries, we're in the top quartile in the country. So an awful lot of work has been done, particularly by colleagues in RCHT and the wider system within the ICB, to get those waiting lists down. And for those in particular that have waited longer than a year, we have done things like harm reviews so that we are very clear about the harm that's happening to people and what we can do to help with waiting well. We've looked at some of the waiting lists that we've got in the community, and one of the inspections that we've had recently that we did in collaboration with the local authority is around SEND services. So we know that the services we're offering, particularly our young folk in some of those waiting lists, is not good enough. So that's neurodiversity, autism, ADHD, and speech and language. Those are the three real priorities for our community services that we have to get ahead of the curve, because we have got long waiting lists. We've just been talking about that this morning. We have 900 children on a speech and language waiting list that have been waiting beyond a year. So we know that that causes a real problem for later years. So we're doing what we call a waiting well. So we are being really clear about those that are on the waiting list and engaging with families. And in some cases, we've actually been able to take families off waiting lists because it hasn't been the appropriate disposition for them. They've needed something else that we've been able to provide. So we've recently had 140,000 come down from the national team, which we've put into waiting list initiatives for our community. And we're doing something called community assessment days, where we're seeing larger amounts of people who are on waiting lists so that we can get to them much quicker. And we've had a degree of success, and we're looking at how we roll that out. The slides that you've got, I'm not planning on going through all of them, because we know that doing death by PowerPoint isn't always helpful. I'm much more up for a conversation with all of you about what you think we've got right and what you think we haven't quite got right. But what I will say is we are really, really clear about the struggles that we have in all parts of our population. And up until I took the acting chief exec role, I was the co-chair for the Start Well. Katie is very much a big part of that work, and recognising some of the real trials that we have and challenges for families who are living in poverty and the outcomes for those individuals. Children in care, we know that we see higher suicide rates in children in care. So being really transparent and open about the particular challenges that we have and talking about them is only going to be for the good of our overall population, and not hiding from some of those challenges. And I'm more than happy to take any criticism so that we improve the offer that we give. I'm going to take a breath, because I'm throwing an awful lot of information at you, and we've got a lot of people. We've got Katie, we've got Ben, we've got Juliet, and we've got John Groom. I was going to call you Groomy, that's his nickname. I do apologise, sorry.
I answer to most things, that's absolutely fine.
I do apologise, that was very informal. To give them the opportunity to talk about the work that they're doing, so that you're not completely bored by my voice, and really look forward to taking some questions afterwards. So who shall I hand? Shall I go to you first, John, to talk about more about the commissioning intentions that we've agreed for our population? Thank you.
Thanks, Susan, and it's really good to see everybody. So just by way of introduction, my name's John Groom, and I'm one of the 3 relationship directors in the ICB. I'm the relationship director responsible for acute services. However, over the last 2 or 3 months, I've been heavily involved in the commissioning intentions work with a number of other colleagues from the ICB, including Janet, who sends her apologies for today. As part of that kind of team working approach, obviously, as Susan's alluded to, we work very closely with our partners in the council. And that's one of the things that I will be sort of stressing, is the co-commissioning of service provision based on informed decision making through gathering information and involving in a conversation with colleagues like yourselves. And then also what we are really working very hard on, which is why it's good to have Juliet here, is an all system approach in terms of taking account of provider capability and provider view in terms of delivering what's realistic. So as Susan's alluded to, often this conversation reflects the power of 3. So in terms of the power of 3, we obviously have hospital to community, we have analog to digital, and we have sickness to prevention. We also have another power of 3 in terms of the way that we have stratified our population in terms of our Start Well programmes, our Live Well programmes, and our Age Well programmes. And then in the pack that you've received, we have another power of 3, which is to create better health, to deliver better health care, and to make the best use of health resources. But there's also a 5, and the 5 is the one that I'm going to talk about. So within your pack, you will see that there is a matrix slide. And in terms of delivering on the 3 main objectives, hospital community, analog to digital, and sickness prevention, we have got 5 main work streams. Those work streams are neighbourhood care, proactive care, planned care with acute to community diagnostics, which supports what Susan was saying in terms of community assessment days and interface days, and then health inequalities and prevention. Now, in your slide deck, the last one is called health inequalities and prevention. In the wider pack, that also stresses co-commissioning. So it's really good to have Katie here. And what we're trying to do is be more informed across the whole piece. And as Susan alluded to, think about the social factors that come in to determine the kind of care we can deliver and the kind of care we need to aspire to deliver. But the main thing for me is that all of this is driven through neighbourhood care and neighbourhood teams being the primary vehicle for us to deliver, and for those teams to be a collaboration of partners across traditional NHS partners, volunteers, third party, council, whoever can get involved to allow us to tailor as best as possible services to the local community. So we all know that we need to retain an acute level of service and an acute traditional provider, but the more that we can do at place to focus on the prevention agenda, the better we are in terms of our local and general health, but also in terms of making best use of finite resources. So a bit like Susan, there's lots in the pack, there's lots that we could say, but I'd quite like us to get to a debate about what the information you've received means for you as a community and for provision of service on the Isles. And I'm going to go to Juliet, because Juliet, you've come up with a few things that we know are kind of operationally pertinent at this point in time. And then if Katie and Sophie want to come in afterwards, and Ben, that would be brilliant.
Thank you, John. So Juliet, hello everyone. I'm the place director for, as Susan said, for West Cornwall, including the Isles of Scilly. And as you know from conversations we've had previously, is the neighbourhood development has been very pioneered actually for Cornwall in the Isles of Scilly, mainly around the change of the building at the hospital and the creation of the care home alongside the hospital, and the changes that's enabled us to make and bring services together, including our Southwest Ambulance Service as well, being incorporated into that whole team in one place, co-locating and be able to co-deliver from that place and using everyone's skills and in a way to coordinate better for the population. So one of the things that neighbourhood have been particularly focusing is around how can we enhance whatever services we can do on the island to where we can not fly people off, because we recognise that it's very disruptive, and if you get back to the mainland and then can't get back home again, that can be protracted number of days, and that's not good for families, for people themselves. So we're trying to look about how can we increase our point of care testing so we can do more diagnostics on the islands, and there's a number of things that we're looking to do around that. So that's kind of rule out things. So we're going to trying to rule out things that we would be going, no, that absolutely needs to be in an acute setting, but almost saying what could we then do and treat people on the island. We're also thinking, this is very much hearing from what our, when we've been over and doing engagement events, what your residents have been telling us around sometimes the lack of coordinations around outpatient appointments, around seeing consultants, where we ask people to come across multiple times to either have diagnostics done and then come back a few weeks later to then see the consultant, or as Susan was saying, if you are in a place around you have a number of conditions, maybe we are asking you coming over in several times to see just that specialty. So that's what we've definitely heard. So I know the neighbourhood team with John Garman as the clinical lead are thinking about how do we coordinate that better for residents. So we coordinate for the residents, so if they do need to come over to the mainland, we can be able to ensure they see a number of people, a number of diagnostics, rather than having several trips back and forth. So that's the other thing I know they're looking at. Community assessment days is another thing I know that they've been looking at, particularly around musculoskeletal, and thinking whether or not we could do a joined up approach and have it more of an open door around people thinking about their movement, how we can help people to keep that core strength, but also those people who may be waiting for treatment, what else could we do to support them with services already on the island? So that's, I know, something they were going to have a look at, and I think they started to plan across in partnership with all people on like services on the island. So we do it as a one-stop shop, so we have a lot of services there together rather than people have to knock on several doors. So I know that's something they're looking at. And then kind of the other thing was we were looking at is where could we through having a multi-agency with people using our health services, either in the GP practice or within the hospital setting, have an ability for consultants to dial in to see people with their GP alongside them, rather than having to fly off. So we can have a more of a joined up plan based on what matters to that individual. So those are some of the few things that they're looking at. We're also working with our emergency consultant at RCHT around if somebody needs emergency treatment, but we can still with the diagnostics hold them on the island, they can provide that remote consulting ability through a digital way of having, you know, this is what we're seeing, what's your advice? So we have a shared care for people to help them stay on the islands. So that's just a few things that are kind of starting to kind of be framed up, very much driven by people telling us around transportation and the trickiness that sometimes brings, and how really they'd like to stay on the island if they can. So I hope that's helpful as a bit of a canter around some of the things those neighbourhood teams are looking at. Katie and Ben, either of you wanted to add anything? Katie?
First, I did just want to take a minute. I do want to like hand over to the room, but I just wanted to take a minute to thank particularly Susan for coming. It is really lovely to have the chief exec to come and present this to us. So thank you for that. And I know your diary is probably rammed at the moment. I think I just sort of there's lots of things going on, and one of the things I'm trying to think through in my role is how do we keep everything feeling really relatable to the residents of the Isles of Scilly. And I think part of that is exactly the bit that Juliet has just been talking about. What is changing in the NHS system is this real focus on neighbourhood health and how we take both decisions and actions within the communities in which people live. And that's a real advantage for the Isles of Scilly. That means there's a strategic shift and there's a shift of resource that's happening that allows us to do things in a way that can really work for the islands. And I think a lot of that is happening through what we call the INT, so the integrated neighbourhood teams. And the Isles of Scilly has its own one of those within the NHS structure that we have locally. And there's some really, really good work happening within that. And Juliet's just named, you know, some of the things that are being addressed through that work. And I find that really exciting. I think the challenge is just one, making sure it feels relevant in this room and that people understand what's going on. And I think, you know, we have a commitment to try and bring that to life. So Juliet and I spent some time last week talking about some engagement days that will happen on the islands. We're hoping towards the end of March, beginning of April, where we'll have 2 days, both on St Mary's, but also on the off islands, to come and talk to residents about what all these plans mean. Because it's hard as a professional who does this full time to keep abreast of what's going on. So I do think it's really, really important that we both invest time in helping people understand what we think the priorities are, but then also opening up that conversation to really understand. So having just said that, I'm going to stop talking because I think it would be really good to turn it over to the room and see if people have got sort of questions, comments, anything that they'd like clarifying.
Yeah, thank you, Katie, and I'd echo the thanks you offered to Susan and everybody else who's contributed to the conversation so far. Before we carry on the conversation, I'm delighted to say we're now quorate in the room, which allows us just to pick up on the formal part of the agenda. So before the conversation starts, can I just go to agenda item 1, which is declaration of interest. Do we have any, please? Councillor John Peacock. Okay. Okay, so I've got no declarations in the room. Urgent items is agenda item 2. I'm not aware of any urgent items, so I think that is concluded. Which brings us to part 1, draft integrated care board 5-year plan. We've had the presentation. Has anyone in the room got any questions, queries, observations they'd like to raise? John Peacock.
Yeah, I think for me, so John Peacock, I'm, for those that probably new on the call here that don't know me, I'm lead member for environment on the islands, but I'm also a member of the council for CFT as well, so a council of governors. So I think for me, my main takeaway from living on an island is the fact there's 28 miles of water between us and the mainland. And I think there are always significant issues that raises all the time. And I think one of the concerns I have, I'm going to raise two particular issues at this point, and then would look for some feedback. But the first issue is, I don't quite know how we deal with mental health on the island. So if there's a mental health emergency, how that's dealt with. I don't think the provision of mental health services is particularly strong on the islands. I'd love to be proved wrong on that. There's, as you say, I really, really welcome all the digital stuff. I welcome the concept of people not having to leave the islands, and welcome the whole integrated neighbourhood teams approach, I think. And I was really pleased to see that we were one of the initial rollouts of that within Cornwall, which I think was really strong. But I'm just going to quickly, you quickly raised transportation. So I can't remember who it was now. I think the lady from CFT. Transportation is a major issue on the islands. We are, the last week, 2 weeks, well, it seems like a year, but I'm going to say certainly 2 or 3 weeks, there's been like 60-mile-an-hour winds every other day. We have 4 modes of transport off the islands. Patients are only able to use 3 of those 4 modes. So I want to ensure that anybody going to any appointment off these islands can use all modes of transport that are available to them. Currently, there's only 3. There are only 3 in use by HTG, and 1 very, very sparingly. So I'm not going to start naming companies because that's not fair, but we have 4 modes. I want to ensure that each mode is used. That's probably enough for me, but I think for me, the mental health area is something that is of concern to me.
Would anyone like to respond specifically on that mental health challenge, making sure that mental health is... I'll give it to you, Susan.
Yeah, thank you. It's a really important question, because, as I said at the start, I think in the past, and certainly in health, we've often been accused of forgetting about mental health. So we are doing an integrated mental health strategy with local authority, actually. And it's something that is from a national perspective is being pushed, and rightly so, hard. What I would suggest is, as Juliet is your place director, is for me to, it's not for me personally, but as a commission, to understand the challenges that you've got, the mental health issues that you've got on the island. Because the other thing that I didn't say is, we've, within Cornwall and the Isles of Scilly, really serious about making sure neighbourhoods get the absolute best start. So we put 6 million into the first year. We're about to put another 6 million in, and then there'll be another 6 million for the following year. So there is money that's available. I think what we would be suggesting is that meeting with Juliet, meeting with Katie, and a broader range of professionals to understand what the issues are, to then be able to say this is what the island needs, that's very specific to the island, would be my suggestion at this point.
And I'm mindful I want that conversation to be around children and adolescents as well as adults.
Absolutely.
Okay.
Absolutely.
So I can see some hands up. So I think, Juliet, your hand is up first. I'll let you come in if that's okay.
Thank you, Chair. So I've just writing down as before Susan speaking, we'll convene something with John Nunes, who's the lead of mental health from CFT, Councillor Peacock, to kind of look at that. And I think it is the whole continuum, isn't it? It's for our children, young people, and our older adults as well. So it needs to be looking at the whole range and trying to really understand the issues that have been faced on the islands, and how do we provide that in a different way that then is able to meet those needs, bearing in mind what you said about the 28 miles of water. We need to think differently. So I would take that as an action away. I was just going to reflect on transport, and I wonder, Councillor Peacock, if you would be able to spare some time perhaps for Katie and I just have a half-an-hour meet with you, just to really understand all the different modes and what we're missing, because I'm really keen to understand what we're missing. But perhaps not for today. We could take that offline and have a separate meet.
Yeah, I'd welcome that meeting. That'd be absolutely fine.
Forgive, I'm just going, I've got some hands up and I've got some lights on in the room. So I'm just going to go to people who've got hands up first and then bring it back to the room if that's okay. Forgive me if I get names wrong. I think, John, your hand is up first.
Yeah, no, that's fine. And actually, Juliet's covered it off. So I was just for purposes of making sure we closed it out, understanding fully the concerns around transport. I used to help manage the transport contract, but if in the first instance you pick up with Juliet and Katie, if required, Juliet, I can talk to Errol and Sam about any specific details that come out of that conversation. So that's fine.
Okay. Sophie, over to you, please.
Thank you. And I think firstly, just to say what a massive amount of work is obviously going on and will continue to do so. And obviously from a policing perspective, I won't pretend to know all the ins and outs of what you're saying and how that would be. But some things sort of came to mind really, and a little bit was touched on by the councillor around ensuring those conversations around mental health and also young people. I'm sure you would recognise that from a policing perspective, mental health is a huge part of our demand. So it would be great. And if there's any conversations on the partnership inspector here for Cornwall and Scilly, so if there's any joined up conversations you want, there's an offer from me to do that. We do work here on the mainland around mental health, so it might be useful. And also my team here is in Cornwall, and again can support for the Isles of Scilly is around young people, working with the Youth Justice Service and just those long-term plans around how to work through the adverse incidents and ensure they're not there. That huge emphasis on the prevention, which is really great to see. I guess my naive sort of question would be is just there's a lot of what we would do and the measure of the success, and it's that middle bit of the how that's going to be achieved. And I guess also coming from a big organisation, the realities of if we're going to make changes around digital improvements or the infrastructures or work collaboratively, it's really hard, isn't it? So where does that come from? Do you plan to utilise the staff that are there already? Will there be the ability for the infrastructure for the training and the upskilling to do so, or do you plan to bring further staff over? I know a lot of these questions maybe you don't know yet and might be too much at this stage, but it obviously begs that question, doesn't it? How will that happen? And where's that the sort of reassurance that there's some sort of beginnings of the plans in place? Thank you.
Go ahead, Juliet.
So I wonder if I can, and Sophie, start to answer, because I think they haven't got a full plan, because I think it is evolving as we're going, and understanding the issues will then, I think we know where we've got some skill gaps, but there are things that are more emerging, and we need to be thinking what is wider available that we can utilise, especially in that digital space, which will only be for some people. I think that's like recognition is digital works really well for some people and it really doesn't for other people. So tailoring our approach is really important. So we just don't say it's one size fits all here and then that's it and we're done. So I think there's something about how do we tailor our approach, and we're looking at excuse the title, it's called patient activation, but I would call it people activation. It's looking around how activated you are in your health and care will help us tailor whether or not that's a person one-to-one or actually the digital, maybe your preferred ways. But within the islands, I think we could do that probably quite quickly around knowing each other probably a bit better than perhaps in other places in Cornwall. So I think there's something around the skill mix which the neighbourhoods are starting to look around. What skills do we need for our population? What have we got and what do we need to grow? And how do we grow our own stuff, but actually what additional things do we need to bring? So it's a bit of a mixed picture for sure, but it's also about recognising the skills you've already got on the islands, but it may not be the job role they're particularly in at the moment. So it's thinking about in a broader scale of it as well. But it's work in progress is probably the best I can say at the moment.
Thank you. Susan, your hand is up and then I'll bring it to
Yes.
thoughts in the room.
Yeah, it was to answer, it's an answer to Sophie's observations, questions. So Sophie, you're right, this has been a big piece of work, and the thing that we've done in Cornwall the Isles of Scilly is we've pressed ahead with the whole neighbourhood model in the absence of any national guidance coming down, and as often happens in the NHS, they promise guidance and then it's delayed. So it's been delayed. However, what I do understand, Penny Dash came down, who's the chair of the NHS, national chair of the NHS. She came down to one of our health and wellbeing centres that's wrapped around a GP practice, Cobra Valley. And she did say that an awful lot of the work that was being done in Cornwall and the Isles of Scilly would actually help inform the national guidance. So it's interesting, isn't it, that we are we're a pioneer in really running with this, but also affecting national guidance. But the other thing I just wanted to say is, in terms of things like workforce, finance, there's a whole suite of plans that will have to sit at enablers, if you like, money, how we transact all of this. This is a huge move for the NHS in the way that we work. And I think one of the things, as I said, in the years that I've been in the NHS, that's always seen us fail is having these sovereign boundaries. I'm an acute trust, I'm a community, we're the local authority. The only way this will work, and you've touched on it, and so is Juliet, is dropping those boundaries, coming together. It's a bit like the Kaiser Permanente model over in America. And the nirvana would be a pooled budget where everybody has got access to. We're not there, we don't have the governance around it. The Health and Care Act don't allow us to do that. But I think the islands has got the benefits of having much closer relationships. And we all know that things work when you know people and when you can talk to people and you can have honest conversations. So my advice would be really take advantage of the fact that it's a close-knit community. You know what you need. Tell us what you need and we will do our best to meet that. But the workforce is a real issue here, because we are going from very sort of traditional roles to maybe things that are AI generated. And some of the feedback that we've got from people's experiences is they felt much more, they felt they got a much more compassionate response from an AI phone call than they did from a human being, which is really interesting, isn't it? So I think we do need to take advantage of digital and AI, but never replace human beings and never replace relationships would be my advice. So watch this space, Sophie. It's ever evolving, and that's where the police, all of our public sector services are so important in getting neighbourhoods right, because we can't do it alone. Thank you. Thanks for indulging me.
Not at all. Councillor Mumford, I think your light may have been on. Apologies if Steve was first.
Good morning, everybody. I think one of the complaints that I particularly get through adults, I'm the lead member for adults, is that discharge from hospital. I think they need to make sure that the patient isn't discharged at 9 o'clock at night when they can't get home. I know we've got a place over there for people to stay, but that's pretty full, I believe. Also, that they're not discharged too soon. It's all very well saying we want to keep people at home, but it's no fun if someone's flown all the way back here and it has happened in the past. 24 hours later, they're back in Trelisk. That's not a very nice experience either, because when you're not feeling well, being humped around on aeroplanes and stretchers and goodness knows what, it's a very stressful thing to go through. So I'm hoping that all wards will be informed about, there must be a proper discharge for the Isles of Scilly, special discharge that they can be discharged in the morning if possible, so they can get, and all travel arrangements must be in place before they are discharged by a doctor. Also, we do have a physio here who's very good. I myself went to her before I had my knee operation. I did go privately, but it would be nice if the NHS could pay for people to go and to get exercises from her to do before they have their operation, because I can tell you it does help after the operation if your muscles are in good nick for hips and knee operations. God help us if we ever have AI and no face-to-face. I would not like that at all. I think face-to-face is very good, and I'm glad to hear that you will be coming over and talking to our community and the off-islanders as well, because I'm sure they'll have lots of questions. That's the other thing about discharge. If they've got to fly here and then they've got to be discharged to an off-island, that's even another step that's difficult. X-rays, I'm hoping that'll be available at the hospital soon on a daily basis, which I know that's what they're trying to get somebody trained for there. And mental health we've already covered, so that's just my thoughts at the moment. Thank you.
I'm happy to talk to those points if that's helpful, and my colleagues will no doubt join in. So the issue of discharge is something that I think is we've not got right for a long time in Cornwall, certainly the 15 years that I've been in Cornwall. So as part of our commissioning intentions, one of the programmes is discharge to assess. So getting people out in a timely way, but you're absolutely right, not so that they bounce back into hospital, but they're also not sat in a hospital bed waiting for onward care, waiting for transport is incredibly important. So Juliet, I would suggest that maybe you check in with Leah Moss, who is the ICB lead for discharge assess, to be really clear that we are taking into account. We do speak to RCHT on a regular basis about the time of day that they discharge people, and particularly on the islands. We can go back and reinforce that, but what I'd like to suggest is that we do an audit to find out how often that's happening, because it's not acceptable. It's not a good experience for anybody. And certainly bouncing back into hospital equally is unacceptable. I think some of the reasons people end up going back into hospital is because of the lack of services within their own area. So things like diagnostic tests, Juliet's just talked about, the ability, as you've just said, to get X-rays. And whilst I would never suggest that AI replaces human beings, I think in order to give a blended service, having some digital technology in order to stop people being flown off the islands and kept and looked after to a high standard is also a part of the whole neighbourhood push that we're going for. I'm glad you've raised pre-ablement. It's the exercise before surgery. This is something that I know the anaesthetists and RCHT are very, very keen to do. And again, I think this is something that we pick up as part of the commissioning intentions, and how we weave that into the neighbourhood plans around how we get people fit for surgery and fit for other treatments as well. So again, I think, Juliet, that's one for the agenda for the meeting that you get there. How do we do that? Because you're absolutely right. It's in the best interest not only of the individual, but of the NHS as well, because it shortens the length of stay in hospital. You get a much better outcome if you're fit for your surgery. So I'm really glad that you've raised that. I will pass over to Juliet just to give a bit of, if you've got any more up to date, or John on X-ray, because I have to say I'm not up to speed on where we're at with that at this point in time. Thank you.
Thank you, Susan. If that's all right, Chair, I'll just carry on. So from an X-ray point of view, we're looking at two different solutions. One is, which Sam Huxman's been looking at, which is X-ray in the box, which is a new technology, which actually is used by a lot of our vets, actually, which can do extremities. But the benefit with that is it doesn't need a radiographer to be able to press the button, because the images are so good that it gives you a better imagery for someone who may not be a radiographer. So anyone can actually press the button, if we can put it that way, and then we can bounce it back to a radiographer sitting in Trelisk, who could then review the films. So I know Sam is looking at that, and we are exploring with Trelisk around training, and it's quite a new technology. So we're just trying to have to go through some of those quality clinical things to make sure that we're not going to put anyone at risk with them. So that's where that's got to. The other option is, which we're also exploring in together, is the mobile X-ray, which we have in a car on the mainland, which is a Fuji kind of, you put it in your backpack and you could literally just stick it on your shoulders and carry it with you. And that's really good images, a very low dose of radiation as well. But we are just being open. We are having a debate and discussion around the College of Radiographers around who could actually press the button for that one, and that's the piece of work. So we've got some training we can do for staff to bring them up to, but we are in a position of negotiation. I'm being very open, in a position of negotiation about how do we progress that with not only the colleges but with RCHT. And Sam is absolutely from our Scilly neighbourhood team is linked into that. But that's the plan, which means that instead of having a radiographer once a week, you'll have an ability to have X-rays every day of the week with the images bouncing back to Trillis for somebody else to read them. So that's where we're going with it.
Thank you very much for that. Steve, would you like to introduce yourself and raise your point?
My name's Steve Manning. I'm chairman of Health Watch Isles of Scilly. A few points. Reference transport, which Councillor Peacock raised. Please be aware that the Health Watch on the Isles of Scilly has a transport and MTTG, sorry, I'm just trying to think what it means, but it's a transport group which meets regularly, and we talk to all parties, and we have the airline, the relative transport bodies there to discuss problems which rise. So if you're going to have a discussion about transport, can you please involve us as well? The X-ray is, yeah, that's something that Sam is trying to get sorted out. And I think the main advantage is not only this mobility, because it can move off to this off-island as well, but it also gives a 3D image, so it gives a clearer image than an actual X-ray. So everybody's keeping their fingers crossed on that one. And something I'm going to say now, the reference to getting rid of silo management. This is something I've been involved with health now for about the last 15 years, from RCHT through to the ambulance service and with Health Watch. And it's something that's been discussed for about the last 13 or 14 years, and we're still trying to get rid of silo management. So I hope this time we might even manage it. But it does really, another remark I make, it does then, if you get rid of silo management, it goes back to the NHS of the 50s and 60s, when it was all one national health service, meaningfully. Anyway, that's it. All right.
So I think there was the familiar anxiety and concerns that transport is obviously a fundamental issue for us living on our collective little group of islands here. But the other sort of wider point I think Steve was raising was this whole thing about silo working. How do we break down some of those psychological and physical barriers to ensure that we're all working as efficiently and as productively and as collaboratively as possible? I don't know if that's a rhetorical question or not.
So I think it's a great question. As I've said, 40 years in the NHS, and I think we've got to land this. We've tried to introduce the Kaiser Permanente model of care into the NHS for years now. I think we've got a real opportunity in Cornwall and the Isles of Scilly. And I'm really clear, for as long as I'm the accountable officer for Cornwall and the Isles of Scilly, we will continue to do that. And that won't change when we cluster with Devon. And in fact, Devon are learning from the work that we're doing in Cornwall and the Isles of Scilly, so that they can start to get up to the same sort of speed and level that we're at in terms of neighbourhoods. The way to break down the barriers, the way to break down those organisational boundaries is through the neighbourhoods. It is through talking and being honest with people, what's working, what's not working. I think we've challenged, I was at a national meeting last week, we've challenged particularly the NHS. I can't speak for any other organisation like the council, for example, because it's separate budgets. It always comes down to money. If we can do something different in the NHS, in the way in which we pay for services at the minute, which is mostly in blocks. We just give blocks of money to our acute trust, to our community providers. If we can start to think more creatively about how that money gets to the right places, means that we can still run a hospital, means we can still run those services that are absolutely vital for people. but equally has some flexibility at a much more local level. And to be able to do that, you've got to have agnostic organisational boundaries. So it's incumbent upon all of us in the way we behave, the way we communicate with each other, the way we do business. That's the only way that things are going to change. Hopefully I might see it before I retire. You've got a couple of years. Thank you.
Thanks for that. No further lights on in the room. Just my observations. I think it's a very easy to read and understand plan. I like the fact it's relatively brief. It's not a sort of very great big weighty document that takes hours and hours to read. In terms of some of my observations, I think most have been covered. For me, it's just how we convert a document that is Cornwall and Isles of Scilly to be very Scilly specific. I think the neighbourhood plan should give much more relevance to our own particular issue. So I look forward to us all working on that. Again, I welcome the sort of suggestion that Scilly can be a pilot for some of this work. We can be a pioneer, we can be a front runner, and hopefully others can learn from us. Personally, I don't like the phrase children at school on page 8. I think I don't know how many children and young people in Cornwall and Scilly are educated other than at school, so just mindful that welcome the conversation we've had around mental health, the need to be as proactive, preventative, early intervention as we can to avoid crisis on those sorts of matters. I can't see any more scribbles from me. So yeah, so from my point of view, it's just how we, in the coming days, weeks, months and years, convert this from a sort of big strategic document into something which is meaningful to the children, young people and adults and families of our own community, and make sure that we can work with Juliet and other people to achieve that. So I think if that concludes our conversation today, we have 2 recommendations on page 2 of the agenda pack. Recommendation A is that members of the board are asked to provide feedback on the draft plan, and I think the conversation has done that. And recommendation B, which we'll take together, is that we confirm the ICB 5-year plan takes proper account of the health and wellbeing strategy and agree to provide a straight statement that it does to be included in the ICB 5-year plan. How do we envisage that statement being produced? I'm conscious that we were a combined joint health and wellbeing board. Now we have Cornwall's health and wellbeing board and Scilly's. So do we need a separate Scilly statement at some point to reflect that?
Yes, please.
Okay. Well, we can.
More than happy to help with how you're able to do that. Very happy to help where I can, or Katie and Juliet between.
I think we have some proposed wording, which would be the statement of support. I don't know if we've got Leah here with us, who always gives us great advice on these things, but I think as long as the board are happy to support the plan, then if the board are happy, we can just work up the formal wording of what you need in terms of signing it off.
So outside this meeting, perhaps Leah, Katie, Susan, we can come up with what's required.
Fantastic. That's really helpful. Thank you.
So do I?
Do you want to add a recommendation to that, to delegate some power for Katie and yourself to do that?
Okay. So just in terms of housekeeping, it's been a suggestion that we have a third recommendation, that the Isles of Scilly Health and Wellbeing Board delegate to Susan, Katie, Leah, myself to come up with the wording that's required. We'll wrap up into something more formal, but that will be the gist of that recommendation. So do we have the proposer and seconder, please, for those 3 recommendations? I've got Councillor Mumford and Councillor Peacock. Okay. Any against? Any abstentions? So that's carried. So I think that concludes the formal agenda today. Thank everybody who's participated. Thank you for your ongoing work with Scilly. Apologies for the slight delay we had at the start of a meeting. We look forward to working with you all going forward, and hope some of those silos are knocked down as soon as we possibly can. Thank you very much. We wish you all a good day.
Thank you.